Alterations in immunity and hematology, pathophysiology and management. Hematopoiesis is the manufacture and development of blood cells. With the lymphatic system, we're looking at the maturation of lymphocytes with the immune system. Different structures include the bone marrow. The soft tissue will fill spaces in the interior of long and spongy bones and also manufacture blood cells. Types of bone marrow include red bone marrow, which manufactures blood cells and hemoglobin, but the yellow marrow will manufacture blood cells under intense stimulation. Blood cells consist of cells suspended in plasma and include a pluripotential stem cell, which produces all blood cells in the bone marrow. Components of the blood plasma include erythrocytes, which are red blood cells, leukocytes, which are white blood cells, platelets, also known as thrombocytes. These will form loose blood clots. Those erythrocytes are designed to transport oxygen and remove carbon dioxide from the tissue. So when we're talking about erythropoiesis, this is the production of erythrocytes. It's regulated by the hormone erythropoietin, and that hormone is released by the kidneys. Erythrocytes require iron and vitamin B, including vitamin B12, vitamin B6, and folate. Erythroblasts are considered immature erythrocytes. Hemoglobin, as we know, carries oxygen to the different cells of the body. And bilirubin is the residual pigment from erythrocytes that have been destroyed by the body. Leukocytes are basically our white blood cells. They engulf invading microorganisms and cellular debris and manufacture antibodies. Leukocytosis is the term for an increased number of leukocytes. Leukopenia is the term for a decreased number of leukocytes. Leukocytes usually will live 1 to 2 days. The demand is continuous, and it's a greater demand if there is infection present. And just FYI, the normal lifespan of erythrocytes is approximately 120 days. So the different types of leukocytes include granulocytes, neutrophils, which are the primary component of the inflammatory response, basophils, which are active in allergic reactions, and eosinophils, which increase in allergic, dermatological, and parasitic infections, and agranulocytes, which are your lymphocytes and monocytes. The lifespan of platelets or thrombocytes is about 7 to 5 days. These are produced in the red bone marrow. They migrate to the injury site and then release a substance of glycoprotein 2B or 3A, which causes platelet aggregation and the formation of clots, and this begins to occlude the injured vessel. Plasma, this is the other part of our blood, and it basically contains about 90% water and 10% protein. It will transport and contain blood cells, protein, clotting factors, vitamins, glucose, lipids, electrolytes, minerals, enzymes, and hormones to the various places in the body. Albumin is considered the most abundant protein in the body, and it helps maintain osmotic pressure. Globulins will help prevent and modify infections, while fibrogen helps form blood clots. The nurse is educating the client regarding nutrition and the prevention of anemia and low hemoglobin. The nutrients involved with red blood cell formation include all of the following except vitamin B12 serves as a coenzyme in hemoglobin formation. With blood, we have four different types: A, B, AB, and O. And our blood type is going to be determined by heredity. The type is determined by identifying the antigen if it's present or not present. For example, type O blood, there's no antigen. We also look at the Rh factor, which will be positive there or negative. So if it's positive, there is a specific protein present. And if the Rh factor is negative, that specific protein is absent. With blood transfusions, both type and Rh have to be compatible. So we do a blood test called a type and cross match. A client is involved in a motor vehicle accident and requires a blood transfusion due to excessive bleeding injuries. The client is type and cross matched for the blood transfusion and is tested as having type AB blood. What type of blood would be compatible for this client? Type O blood, basically because there is no antigen. Type O can be given to everyone. So it's what we consider to be the universal donor. Our lymphatics are going to circulate interstitial fluid and carry it to the veins. It filters and destroys pathogens and removes other harmful substances. It's composed of several different parts. That includes the thymus gland. This produces lymphocytes during fetal development, and after birth, it's going to program T lymphocytes to become regulator or effector T cells. They are going to become smaller during adolescence. The spleen has both a hematopoietic and immune function. It is an emergency reservoir of blood and removes bacteria and old or damaged red blood cells from circulation. Lymph nodes are part of the lymphatic system, and they consist of vessels that drain tissue fluid or lymph fluid. B lymphocytes and T lymphocytes that remove bacteria and other foreign particles from the lymph, and superficial lymph nodes are located in the axilla, groin, and neck. Lymph fluid will pass through the node, and then macrophages will attack and engulf those substances. During our assessment, we need to determine, has there been prolonged bleeding from an obvious injury? Has there been unexplained blood loss? Is the client feeling fatigued and faint with normal activities? Is the client easily chilled? Do they have frequent infections? What is their dietary history? We're assessing for compromised nutrition. What is their drug history? In other words, what do they take by prescription? What do they take without prescription? Do they take aspirin or anticoagulants, antibiotics, or cancer drugs? Have they had any foreign travel? We do know that malaria and parasitic roundworms are common with travel and can cause anemia. When we do our physical exam, be sure to look at the skin for the color, temperature, ecchymosis, other lesions. and check the pulse to help determine inadequate hemoglobin levels. We also want to do palpation of the lymph nodes. Are they tender or swollen? Inspect the tonsils. What is the size and appearance? And is there any purulent exudate? And also check the size of the extremities. Is there unilateral enlargement? Because if there is unilateral, meaning one side, that could mean we have an obstruction of lymphatic circulation. Different diagnostic tests include taking blood samples, such as a CBC, hemoglobin, prothrombin time, or fibrogen levels, doing a bone marrow aspiration or the Schilling test, which diagnoses pernicious anemia, macrocytic anemia, and malabsorption syndromes. We can do lymph node biopsy or an ultrasound of the spleen or a lymphangiography, and x-rays, CT scan, bone scan, or MRI. The nurse needs to monitor clients taking medications that can contribute to hematopoietic dysfunction. Medications that interfere with the hematopoietic system include warfarin. Very important to educate our clients. But before we do that, we do need to assess their level of knowledge on procedures and treatments, etc. Make sure that we offer a description of any routines that the client may be getting ready to go through or may be recommended to follow. Use standard precautions, for example, gloves when collecting specimens. Get those vital signs and notify the provider regarding any adverse readings, and analyze and report test results. With the immune system, each individual has body cells that are coated with histocompatibility markers that separate the body from self to non-self. Self meaning it belongs with this person. Non-self means it's foreign. If a non-self substance enters the body, then the immune system will protect, defend, and destroy cells and substances that are atypical or abnormal. The immune response primarily will attack infectious, foreign, or cancerous cells. So the immune system is a collection of specialized white blood cells and lymphoid tissue that maintain immunocompetence, which is the ability to cooperatively protect a person from external invaders and the body's own altered cells. Function of these structures is assisted and supported by natural killer cells, antibodies, and non-antibody proteins or cytokines. White blood cells, once again the leukocytes, are produced in the bone marrow and stem cells. We have several different types, as we've already referred to, but the lymphocytes, these are going to be your T cell or B cell lymphocytes. They're primary participants in the immune response. They're going to distinguish harmful substances and ignore the natural. Those T cell lymphocytes, we have several different kinds of those. We have regulator T cells that are made up of helper and suppressor cells. Helper T cells that are important in fighting infection. Suppressor T cells that limit or turn off the immune response in the absence of continued antigenic stimulation. Effector T cells are those killer or cytotoxic cells. A cell-mediated response happens when T cells survey proteins in the body. They actively analyze the surface features and respond to those that differ from the host by directly attacking that invading antigen. The B cell lymphocyte matures in the bone marrow and then migrates to the spleen and other lymphoid tissue. It's composed of plasma cells that produce antibodies and a humoral response from an antibody response, and is also composed of memory cells that convert plasma cells on re-exposure to a specific antigen. Neutrophils are phagocytes, or cells that perform phagocytosis, or the process of engulfing and digesting bacteria and foreign material. They're also called microphages because they're small, present in the blood, and migrate to tissues. Monocytes are macrophages because they're large. They're present in tissues such as the lungs, liver, lymph nodes, spleen, and peritoneum, and they will migrate after a cell-mediated response. And then that lymphoid tissue, the next thing in the immune response, is going to play a role in the immune response and prevention of infection. Again, we have the thymus gland that programs the T lymphocytes to become regulator or effector T cells, the tonsils and adenoids that filter bacteria from tissue fluid, the spleen, which is an emergency reservoir of blood, but also removes bacteria and old or damaged red blood cells from circulation, and the lymph nodes, which are the vessels that drain tissue fluid or lymph. So which of the following is a function of the macrophages and neutrophils? Phagocytosis. Natural killer cells are lymphocyte-like cells that circulate through the body looking for virus-infected cells and cancer cells. The non-killer cells identify atypical markers on the membranes of these cells. Then they release potent chemicals that lethally alter the target cell's membrane. Cancer cells tend to escape the non-killer cell surveillance, which allows cancer cells to spread beyond the primary site. Antigens are substances that produce a response in the body. In other words, it's foreign to the body. Antibodies are proteins that are produced in response to exposure to an antigen. These proteins are produced by the B lymphocytes, plasma cells, referred to as immunoglobulins. There's 5 types of immunoglobulins: IgA, IgD, IgE, IgG, and IgM. Immunoglobulins are going to bind with antigens and promote the destruction of invading cells by hindering antigens physically by neutralizing their toxins, linking them together and creating agglutination, or causing them to precipitate or become solid. Non-antibody proteins are going to provide an additional method for disabling antigens and further protecting the body. This can be a complement system, which is made up of many different proteins that are activated in a chain reaction when the antibody binds with an antigen. We call this opsonization, where proteins cooperate with antibodies to attract phagocytes and coat antigens to make them more recognizable for phagocytosis. Cytokines are those chemical messengers that are released by lymphocytes, monocytes, and macrophages. The interleukins carry messages between leukocytes and tissues that form blood cells. For example, inflammation and fever, scar tissue by fibroblasts, growth and activation of the non-killer cells and additional T cells, and mast cells. Interferons are chemicals that primarily protect the cells from viral invasion and enable cells to resist viral infection and slow viral replication. Tumor necrosis factor is a type of cytokine that helps in the cellular repair when it's administered in small doses. Immunity to a disease after recovery is possible because the first exposure to the pathogen has stimulated the formation of which of the following? Memory cells. So we have different types of immunity. Naturally acquired active immunity will occur as a direct result of infection by a specific microorganism. For example, measles. Artificially acquired active immunity will result from the administration of a killed or weakened microorganism or toxoid in a vaccine. And, for example, that would be influenza. And passive immunity, we have ready-made antibodies that are given to a susceptible person. For example, newborns will receive passive immunity to some diseases for which their mothers have manufactured antibodies already. A baby is born temporarily immune to the diseases to which the mother is immune. The nurse understands that this is an example of which type of immunity. Once again, that's the naturally acquired passive immunity. During our assessment of clients with the immune system, we need a history of immunizations, recent and past infectious diseases, recent exposure to infectious diseases, their drug history, and their allergy history. With a physical examination, these clients can appear healthy, but they can also appear acutely or even just mildly ill, malnourished, extremely tired, and or listless. Make certain that you examine the skin for rashes or lesions and assess the abdomen for an enlarged liver or spleen. Also inspect the pharynx for large red tonsils and drainage. Different diagnostic tests include the CBC with the differential. The differential is basically going to show the different types of blood cells. In other words, the white blood cells is going to show your neutrophils, your eosinophils, your basophils, etc. Your protein electrophoresis screens are going to detect diseases that are associated with deficiency or excess immunoglobulins. The T cell and B cell assays are enzyme-linked immunosorbent assays. Skin tests can detect disease-specific antigens. And anergy is the inability to mount an immune response. This is a common issue with AIDS or immunosuppression. Very important to identify allergic substances, any hypersensitive reactions, explain diagnostic skin testing procedures, and inform when to return for interpretation of the results. Using standard precautions, following agency guidelines for controlling infectious diseases, Excuse me. Or protecting the client who is immunocompromised. These are all major tasks for the nurse to complete.